the arm. Why does the government consider dental oh, well, that's a great question, isn't it? How many of us now, here, even with insurance, can open our mouths and show lost teeth that shouldn't have been lost? A lot of us, right? Who have had teeth pulled because we couldn't afford to get them fixed. I was sharing with folks today, I have dental insurance, and yet I do that calculation every time I think about it. I haven't been to a dentist since 2005. Nothing hurts yet. Nothing hurts. I'm not going. If nothing hurts, I'm not going. Because I don't want, what they're going to say to me is they'll find one tooth, they'll fix it, it'll max out whatever benefits I have, and then they'll say, oh, but by the way, Donna, we should do this and this and this and this, and that'll be $2,500. I can't do that. So why do they consider dental health any different? I don't know. It's a huge determinant of health. Obviously, we heard about cardiologists worried about what kind of infections come to the heart from having bad dental health. There's a lot of other things. We remember the story of a young boy, 11-year-old in Maryland, who died because of a tooth abscess. It's a huge determinant of health. And mental health care, crazy. I tell people that we develop our own form of post-traumatic stress in this country based on finances as well. Truly, we do. We absolutely do. I mean, we work people and we scare people and we make them think they're not doing enough. I mean, I vividly remember the day Larry and I were in the bankruptcy trustee's office in Rapid City, South Dakota, with our bankruptcy papers 4 days before he had another heart surgery. And the bankruptcy judge goes through all this stuff. And he looks at this wonderful man, this proud guy that I married 34 years ago. He says, how did you get yourself into this mess? And I don't think Larry has really ever come out of that mental. You know, men put a lot, at least in his generation, put a lot of importance on being able to take care of their families and do what they need to do. And that's been a real hard thing for him. Not very good for heart health, I'll promise you that. Okay, let me see. There's another question that's a real direct one that I think I'm going to ask Chris's help to answer too, because I think it's a really important one. Somebody asked a really direct question about a friend who has no health insurance, who's gone through the point of a first diagnostic appointment, told she needs follow-up tests, doesn't have coverage, has asked how much they cost, and no one will even answer that for her. I certainly have seen that played out with people. Try and get a cash price out of somebody for some of this stuff. You can't get one. It's like being, you know how when you get on the airlines, you're pretty sure some people paid $100 for the seat and some people paid $500 for the seat. And one seat doesn't cost. It's the same in our healthcare system. You can't get a price. If you ask, how much does an MRI cost? Well, that depends. You know, are you a Medicare patient? Are you a Blue Cross patient? Are you a Blue Cross PPO, HMO? Are you a Aetna? Are you Cigna? Are you, you know, by the time you get done with it, could someone tell me how much it costs? No. So, you know, for the vast majority of people, that's where it ends. That's where it stops. They can't get forward to get any care unless they can go to a community clinic or to a healthcare provider that will sit down with them with some financial counseling, which is also very demeaning to have to go in and set up some payment plan in advance of getting care. I've had to do that too. Very demeaning. So would there be options in Washington State?
Yeah, there's a couple things. So our local office that tries to get people hooked up with insurance is called WAHA, Whatcom Alliance for Healthcare Access. That's right up on Chestnut Street in the 800 East Chestnut building. Interfaith Clinic and CMAR are sort of the community clinics for dealing with lack of health insurance problems, and they're Bellingham, Ferndale. 676-6177 is the number for Interfaith. The hospital is tied in with Peace Health, and all the specialists, most of the specialists are in Peace Health, and they have their own bridge program that kind of helps you try to get discounts, and they sometimes do a good job in volunteering that information, and sometimes they don't. The basic health plan is great, but now it's, you know, there are 100,000 people on the waiting list or something. So help us get this passed, and you'll be a lot more people available to get into the basic health plan. So that's if it's through Washington Breast and Cervical Health Program, that covers free pap smear and mammogram testing. In the beginning, it covered the free testing, but if they actually found something, sorry, you're out of luck. And then they decided, maybe we ought to cover the treatment for the cancer if we find it. So they kind of added that on after the fact.
That's good. I'm glad.
So talk to me, whoever it is, talk to me later if that doesn't answer it. I'm not going to think of anything else I can think of.
Thank you very much, Chris. I thought you might know more about Washington State, since that's a pretty specific question. Another good question. What articles, documentaries, books, speeches would I suggest to recommend to somebody with an opposite opinion? Something that has